have very, very bad arthritis in my knees. I've had double knee surgery in the mid-90s, and it's gotten progressively worse.
Since I broke my wrist 6 years ago, I've had arthritis in my wrist and my thumb.
I've had neurospinal surgery, a laminectomy and a microdiscectomy. I still have pain.
Chronic pain takes a terrible toll. This abnormal amplification of pain that so many pain patients have, it makes people sad. It makes people hopeless. It makes them very anxious, because if you're a chronic pain sufferer, you don't know what's going to happen tomorrow. You don't know if you try to go down to the grocery store if you're going to pay for it. You don't know if you try to climb those stairs more than once, are you going to end up in bed? So chronic pain patients live in fear of the pain getting worse.
The biggest problem in terms of pain is arthritis.
Arthritis is a multifactorial disorder. It affects a great segment of the population, a huge segment. Over 50 million people have some form of joint disorder.
Arthritis, if you break down the word arth, is from joint, and itis is inflammation. So it's inflammation of the joint. And the two most common types of arthritis are, one, osteoarthritis, which is the largest type of arthritis that almost everyone's going to get. It's really the effects of aging. Then there's rheumatoid arthritis, which is an arthritis that has to do with the body attacking itself. It's called an autoimmune disease.
They're the inflammatory arthritises, and the osteoarthritis, which is generally non-inflammatory. So you have rather different causes between these two different forms. The inflammatory arthritises are caused by a distortion of the immune system. When the immune system starts to attack your own tissues, your own connective tissues, your own joints, the structural tissue around the joints get attacked by the immune system.
Your body has been triggered into making antibodies to attack its own tissue. So that's, fortunately, a smaller percent of arthritic conditions.
That is a not so common but a difficult condition that needs to be treated from the immunological point of view.
Not all of the pain comes from tissue damage or something dreadfully wrong in the part that hurts. The nervous system has an intrinsic ability to exaggerate pain signals.
Pain starts in the periphery and then goes up into the spinal cord. When you have pain, something very interesting happens. If the pain persists even a very short period of time, it changes the physiology in the cell. We call that sensitization.
The pathways get sensitized. And so I see someone who may have torn a rotator cuff, we rehab that shoulder, the rotator cuff heals, but she still has pain. Because the pain went on, it was long-lasting, the pain actually takes on a life of its own.
The way things are in convention nowadays, with a person going over and over to orthopedics and specialists and taking pills, that person has no future, because with those remedies, the joint does not heal. Actually, slowly it gets worse.
There are close to 400,000 knee and hip replacements in the United States each year. There's close to 400,000 back surgeries in the U.S. per year. Now, many of these are life-saving for the patient, and a lot of them are unnecessary. And if it's unnecessary, that's at a huge cost and probably unnecessary suffering.
Alternative medicine, or if we want to call it integrative medicine, which is the combination of alternative medicine and conventional medicine, offers the individuals affected by joint ailments, offers a future, offers improvement, offers healing, offers a decline in the pain, offers an improvement on the function, offers a better future.
If a person has active pain, there are certain herbs and anti-inflammatory nutraceuticals which are wonderful. Things like fish oil, I think, is a very gentle anti-inflammatory. Devil's claw, cat's claw, boswellia, curcumin, I think, is wonderful, which is turmeric, widely used in Indian medicine.
We can do antioxidants like vitamin E or CoQ10, or even vitamin C.
Vitamin C is a major component of collagen. So you want to have a lot of vitamin C on board because that will help to set some of this cartilage structure and framework to enhance your healing process.
I cook a lot with organically grown onions, shiitake mushrooms, enokis, matakis. These mushrooms, medicinal mushrooms, are very healthy for you. Organically grown leeks, organic baby bok choy. And then you put in the anti-inflammatory herbs, the turmeric, the ginger, the garlic, cardamom, cinnamon, whatever you like. I love curries, incredibly healthy.
I really enjoy using acupuncture, especially for more difficult cases, because I think it's a good way to get in there and kind of bring the energy back to it and start moving the energy in that area.
When you put an acupuncture needle into somebody's limb, you do stimulate the release of morphine-like compounds in the brain and in the fluid that surrounds the brain, the cerebral spinal fluid. It has also absolutely been shown that acupuncture blocks the pain transmission coming up to the brain from the body that hurts. In the spinal cord, there are these gates that the pain has to go through. And we know that acupuncture does tend to close these pain gates, letting less of the pain come up to the brain.
Prolotherapy I've used for many years, and that involves using nutrients, B12, glucosamine, D-ribose, saline, dextrose, calcium, to stimulate blood flow into the tissues. And that's been around for almost 100 years. It's a wonderful, safe treatment, always works.
By trying to keep the patient in motion with physical therapy, aquatic and pool work, walking program, self-stretching, these are foundational.
We can't do compartmentalized medicine. It's got to be the whole person. And in a way, we've got to go back to where we used to be, to our roots of really treating the whole person. And sometimes high technology hasn't really resulted in better care. If you look at the cost of neck and back pain, for example, from 1997 to 2005, it went up from $52 billion to $86 billion. A 64% increase. In that same period of time, the number of people reporting being disabled from neck and back pain rose by 25%. We spent $34 billion more, and 25% more people are disabled. We're doing something wrong.